plastic surgery and it's hump day with Dr. Earle. So this is the time I get to spend with you guys and go through some plastic surgery topics and of course answer any questions that you guys may have. And so today I think what's a pretty interesting topic is something that kind of gets asked a lot. I have tried to explain it in the past, kind of as part of, say, my lipo talks or my BBL talks. And you know, for some reason, the concept doesn't seem to go through. And even sometimes, you know, some patients don't kind of like want to seem to believe it. So, so I thought it was very important to try to explain things. I'm actually kind of have like some depictions here. I also I'm going to try to do a little demonstration as well. And hopefully kind of, you know, with all that, you know, the concept will become more clear. And so what we're going to talk about here today is skin elasticity, okay? So why is it important that we talk about it? Because it really affects, you know, the outcomes after liposuction. And of course, for BBL as well, since liposuction is part of the BBL procedure, okay? And so skin elasticity is very variable, okay? It really is very different from patient to patient, okay? And honestly, for the most part, at least for most patients in my practice, it is not ideal. So most of the patients that I see do not have ideal skin elasticity for, you know, multiple reasons, which we'll go over here in a second, okay? But it is quite important because skin elasticity is what allows the skin to bounce back after liposuction, okay? And to kind of allow things to be smooth. And if you don't have, you know, the right amount of skin elasticity, if for some reason it's not ideal, then it may not bounce back as well. And when it does that, okay, typically then it may not bounce back evenly, okay? And many times what happens is that it starts to kind of collect around a fixed point, which is right in the middle of your abdomen, and that is your belly button, okay? And so when that happens, that skin tends to kind of hood over the belly button, okay? So it's not that there's uneven lipo, which most people think that's what it is. It's not that there's fat left behind or that the area was forgotten. I mean, it's really quite difficult to forget the area right around the belly button. It's right in the middle of everything that we're doing. But what it is that the skin is not has not been able to bounce back, and it hoods over a fixed point, and that's why it creates that look. Okay, so what are we talking about? So I have here they just have it separated as younger skin and older skin, but really you can think of it as ideal skin elasticity versus non-ideal skin elasticity, because it's not just about age. There are multiple factors that affect this, and I'm going to go over each one of them, okay? But if you can see this here, you see these kind of white lines that we have coming across here, they're forming these little X's here, okay? That's what gives the skin, you know, those are the elastic fibers, okay? And when they're intact and there are lots of them, then you have great skin elasticity. That means that skin is really able to bounce back. So you can like stretch it and it'll bounce right back, okay? And that's very important, because when you take something that's full and then you deflate it, if it's able to bounce back, then it remains smooth, okay? But if you take something that's full and then you deflate it and it can't bounce back, then it becomes wrinkly, okay? Like you see up here. So you see how the skin, they depicted the skin here as smooth, okay? And then go to this one. The skin here is not smooth, it's wrinkly, okay? Deep wrinkles. It can be anywhere from mild wrinkles to deep wrinkles, okay? So when you have non-ideal skin elasticity, you don't have as many of these elastic fibers. You also have less collagen, okay? And then when you deflate something, when you remove volume, which is exactly what you're doing with liposuction, right? You're sucking out fat, you're reducing the volume, then it's not able to bounce back, it's not able to remain smooth, and it becomes wrinkly, okay? And you can see that there, all right? So what causes this? Why do you start off with this great amount of elastic fibers, with this great amount of collagen, and then you end up with a non-ideal situation, okay? Well, there's multiple reasons, okay? So I'm not sure if you can see all that there, but one of the reasons is sun exposure. Sun exposure is terrible for the skin, okay? Now, it really, you know, messes with the elasticity, and you can see that mostly in, like, say, for example, in a face, okay? When you get those multiple fine wrinkles in someone who like exposes their face to the sun a lot, that's the effect that the sun has on the face. And usually when you have these multiple fine wrinkles, they're very hard to treat. Okay? The other thing that really affects all this is smoking. Okay? Smoking and nicotine are terrible for the skin. All right? When you see longtime smokers, when you see they have those multiple little wrinkles all around their upper and lower lip, okay, that's because that's the closest place to the cigarette, the closest place to the nicotine. It really forms those fine wrinkles around there, which are very, very difficult to treat. That's where you see the evidence of that. But it affects your skin overall, not just the face, but the entire body. Don't smoke. If you want great skin, do not smoke. Do not expose it to the sun. Of course, age. As you get older, you lose collagen, you lose elastic fibers, and the skin becomes less elastic. Okay? Pregnancy. Okay? Pregnancy will do that because of the stretch. Once you stretch things out, okay, then you start breaking up some of these elastic fibers. Okay, and so then it doesn't then have the ability to bounce back afterwards. And so that's why there's many women who've had one or multiple pregnancies and then they have loose hanging skin in the lower abdominal region. Okay, that skin has been stretched out, these elastic fibers have been broken, there's not enough, not able to bounce back after giving birth, and so then that's why women become candidates for a tummy tuck after at that point in time. Okay, so what is some evidence of that? Stretch marks. Stretch marks are evidence that skin is definitely not going to be as elastic as it was before. When you have stretch marks, that skin's been spread thin, those elastic fibers have been broken down, there's less collagen in that area, and so that is not good quality skin. Skin with stretch marks is not good quality skin. Okay? All right, weight change. Okay? People who have fluctuated in weight, people who have are higher BMI. So if you're like in the overweight or obese or super obese category, okay, that skin has stretched out. That skin could potentially also have stretch marks. That skin has lost the elasticity. And then the unfortunate thing is that when you lose the weight, okay, whether it's by diet and exercise or by a gastric bypass or some sort of bariatric procedure, that's been kind of lost permanently, and that skin doesn't really kind of go back to its pre-weight gain state. Okay. Now, if you do things slowly, okay, if you say you're going to lose 50 pounds. If you lose 50 pounds within a month because you had a bariatric procedure, that really does not give the skin a chance to bounce back, and you're going to have more saggy and loose skin. If you are to lose weight slowly, say through a very kind of gradual diet and exercise program, and you lose 50 pounds over a year, then that skin does have a much better chance to bounce back. And then those patients tend to have less issues with saggy skin. Okay? All right. Dehydration. Dehydration is a big problem. Most of us don't drink enough water. I'll admit it myself. I don't drink enough water during the day. I'm in the OR, in the clinic, I'm running around. I should be drinking much, much more water than I do. We should all be drinking about 1 gallon of fluid a day. And honestly, most people don't do that because there's not enough time, because they're not carrying a water bottle with you, etc. Dehydration will definitely affect this. It will definitely decrease the number of elastic fibers and collagen in your skin. Okay? And then, of course, certain hormonal changes. So estrogen is actually protective for the skin. And so as women become older and the estrogen levels start to come down, especially after menopause, then that really affects the collagen levels and elastic fiber levels in the skin, and that skin becomes less elastic as people get older. Okay, so what can you do to kind of help the situation? I mean, there's some things that you definitely can do. There's some things that are hard to avoid, and of course, if you want to have children, you're not going to avoid pregnancy. But I have it right here as the first two because it is so important. Hydrate, hydrate, hydrate. Okay, hydration is incredibly important. You want to be doing this every single day. You want to be drinking 1 gallon of fluid a day at least. And you really want to maintain that skin moist, and you want to maintain that skin hydrated. But more importantly for us, for what we're talking about here, hydration after liposuction or after BBL is incredibly important. Okay, I always tell all my patients they got to drink at least 1 gallon of fluid a day. Ideally, you get up to even 2 gallons of fluid a day, anywhere between 1 to 2 gallons of fluid a day. The effect that has on your long-term results is drastic. Okay, if you're able to really, really hydrate, the chances of having uneven skin and the chances of having fibrosis are much, much less. So if you combine wearing, your adequate garments, okay, where you have just enough compression but not too much, where you're taking away basically blood supply to the skin. You don't want to overdo it. So when you have adequate compression, adequate postoperative care with lymphatic and post-lipo massage, okay, and adequate hydration, that's when you give yourself the best chance at having skin that retracts back, okay? All right, so hydration, hydration, hydration. Of course, sleeping well, eating healthy, and exercise all contribute to skin elasticity. So you want to do that as best as you can. You want to get your good sleep, 8 hours a night. You want to eat healthy, not a lot of like fried foods and stuff like that. You want to eat, if you're going to eat fats, you want to eat the healthy fats. You want to eat your avocado. You want to eat your salmon with the omega-3 fatty acids, okay? That's the type of fats that you want to take in, all right? Exercise definitely helps. You see people that work out, their skin tends to be tighter. It tends to be tighter around their muscles, around their core. So exercise does help with skin elasticity as well. Okay, and then of course if you're going to be in the sun, you must wear sunscreen. You want to protect the skin from those UV rays, which basically kill off elastic fibers in the skin. Okay, and then moisturizer lotion is incredibly important. Okay, you want to use something like it can be as simple as a cocoa butter moisturizing lotion. You want to keep that skin moist. You want to keep that skin hydrated for it to be the best quality skin. Okay, but having said all this, most patients are not the ideal patient. They're not going to be someone that's, say, in their 20s, who's never been pregnant, never really exposed themselves to the sun, never smoked, never was overweight. Their BMI was like, between 22 and 24 all their life. Always hydrating, and so that's like the ideal patient. And in that patient, they're going to have great skin elasticity. They're going to bounce back. They're not going to have unevenness in their skin. They're not going to have wrinkling in their skin. They're not going to have hooding over their belly button, okay, for the most part. But what percent? I mean, that's a very low percentage of patients. And these are the patients that I see in my practice. So most of the patients that I see have had a few pregnancies. They're not 20, they're older than 20 years old. They've had weight changes or fluctuations in weight. Their BMI is typically higher, say anything above 25, which is then considered overweight, or and then anything greater than 30, obese, and then my max is 33.5. Okay, and then of course nobody, including myself, hydrates as much as they should. Okay, so when people ask, why is it that we see this fairly often? Why do we see like the skin wrinkling? Why do we see some of the hooding over the belly button? Well, the answer is because you have non-ideal skin elasticity and the skin didn't get a great chance to bounce back, and therefore the treatment for that is typically not further lipo. Okay, further lipo is not going to help, but you need a skin tightening type of procedure. Okay, all right. If it's a mild case, then that would be something like body tight. You've heard me talk about body tight before. All right. If it's kind of in the middle of the road, kind of a moderate case, then it would be perhaps a mini tummy tuck. Okay. And for more severe cases, then the answer is a tummy tuck. Okay. But you need some sort of skin tightening procedure to improve that. Okay. All right. So I figured, I've talked about it. You've seen this. I figured I'd try to do a demonstration. I was thinking last night, like, what can I do to kind of show this point and perhaps make it a bit more clear. Okay, so I grabbed some things I had around the house, and one of them is this kind of red ball that I have here, and a couple of shirts, and I filled it up, and so I want to show this here. So, okay, so this first shirt that I have on here, okay, that's just kind of my regular kind of pure plastic surgery shirt, and this is a demonstration of kind of the non-ideal, non-elastic stretch. See, it doesn't really stretch much. I kind of stretch it as very stiff. It's a stiff type of shirt, so there's no bounce back, there's no elasticity to that shirt, okay? So, if you're starting off with a fairly full belly, okay, so the shirt's kind of wrapped tight around that belly, then things look fairly smooth, right? Okay, so that's how you come in. You come in because you have fat, and you want me to basically take care of that fat with a liposuction, okay? So you have a fairly full belly, and we're going to call that belly full of fat, and then the skin feels smooth along that fat. But then we do a liposuction procedure, and we basically remove that volume of fat in a fairly rapid way, right? We do it in an hour or two. I mean, we're talking about the front is an hour, the back's another hour, okay? So within the hour, we all of a sudden reduce all this volume, okay? If you have ideal skin elasticity, then the skin is able to kind of just shrink down and remain smooth. But if you have less than ideal skin elasticity, then it starts to kind of wrinkle up, okay? Kind of like this shirt is kind of wrinkling up over this ball here, okay? Right? It's not bouncing back. So you have these wrinkles now. All right, now, add to that the fact that you have, say, a fixed point right in the middle of your belly. That's your belly button. If the skin is loose above it, right, what happens? It starts to hood over that fixed point, which is the belly button. So this skin is loose, it tries to go down, but at one point it has to stop because there's a belly button there, a fixed point, and it can't go down, and so then it hoods over. If we didn't have a belly button, then maybe it could do that. It could just all go all the way down. But we do have a belly button, so my finger is simulating the belly button, and so it hoods over that belly button there, and that's why that happens most commonly around the belly button, okay? All right, but now, let's say, for example, you have better quality skin, okay? So, I took my wife's workout shirt here, okay? All right, so now this is a spandex type of shirt. It bounces back. See how it bounces back? This is a good quality skin, okay? So when you deflate, it remains tight, okay? So let's do a little demonstration there. So I'm gonna deflate this ball, okay? And that's slowly gonna go down. And we'll see how as the ball deflates, this still remains fairly tight around that area, even if there was a belly button here, because the skin, okay, in this case the spandex type shirt, has a lot of elasticity and it's able to bounce back, okay? But now, as the volume becomes less and less, I want you to start noticing something even with the quote-unquote good quality skin, okay? All right, let me see if I can bring that up close. You see how it was completely smooth before? You see how I haven't touched it? You see what's happening here? Okay, you see how it starts to wrinkle up? Okay, that's the demonstration that I really want to show you guys here, okay? So even though this is the spandex, okay, the better quote-unquote quality skin, as you decrease that volume, it starts to wrinkle up. And if you had a fixed point here, it will wrinkle up over that fixed point, okay? Now, so then what do we do after surgery to try to prevent this? Then we hydrate, we do our compression, and we do our massages. And so we have the Coraito, the lemon lady, and she's squeezing, she's moving the skin around, and she's basically doing this. She's basically doing this and trying to get that skin to smooth out again, okay? All right, and if you have good skin quality, then it'll do that. But if you have poor skin quality, then it won't. It'll remain wrinkly. It'll hood over the belly button, okay? All right, so I know that was a very crude demonstration, but I hope it exemplifies the point, okay? So now I'm ready to take questions.
We got a lot.
Okay.
At what age does the skin start to age in this way?
So unfortunately it's quite young, so it's not, you know, it's definitely before we feel old. I would say by about 30, it already starts to happen. So you know, if you're, of course, in your teens and your 20s, you still have very good quality skin, but by the time you start reaching 30, some of these things start to happen. You've had enough sun exposure, the age, the amount and the number of elastic and collagen fibers start to decrease. You may have had some changes in weight, okay, already by that time. And then of course, you know, none of us are staying as hydrated as we should be, and you may have had 1 or 2 pregnancies. So all these factors come into play, but if you're gonna give me an age and I just have to throw something out there, I would say about 30 and above.
And when you brought up stretch marks, what about, there's a lot of patients who are saying they've had stretch marks since they were in their teens. So is that a sign of bad skin from that age?
Yeah, unfortunately, that's typically because something happened. A lot of times it's some like fluctuation in weight during that time. So sometimes and then also, you know, hormonal changes. So that's why it happens around that, you know, around the teenage years, okay? So hormones start to shift, and then a lot of times you gain significant, significant amount of weight. You may have gone through like some sort of spurt or growth, and all these things, you know, stretch out the skin. Once the skin's been stretched to the point that there is a stretch mark, then that skin is no longer as good quality as before. The stretch mark is basically evidence that something has happened to that skin and that you've lost elasticity to that area.
Is it beneficial to take collagen prior to surgery?
I think it could help. It certainly can't hurt. Now, have I seen like actual studies in the medical or plastic surgery literature to say that definitively it's going to improve things? I have not. But it definitely can't hurt. It's not going to affect your surgery, and so I think it's something to consider.
Typically, when one inquires about a BBL, would you warn them about the loose skin afterwards, or is this very hard to predict? Also, can you conduct body tight during the BBL procedure to ensure that it stays tight?
Right, okay. Three-part question.
Yeah.
I think that was, okay. Part number one, do I warn them? I try. I definitely do. So I see all my patients, I try to see all my patients the day before surgery. Now with this COVID thing, things are a little bit more complex. Some people have to see the day of surgery because their test is not back. But ideally, I see everyone before surgery. That's what we strive for. And then I spend a good amount of time with that patient. There's no rushing. You know, I sit down with them. I go over all the expectations. And one of the things I talk about is, you know, the skin. And I tell them, you know, whether I think they have good quality skin or poor quality skin, and then I always say that how well that skin retracts is unpredictable. That's the one thing that I cannot predict. Okay, so it's unpredictable. Yes, we do talk about it. Okay, and then can we do body tight? The answer is yes. So we need to add body tight to certain areas to try to help. Then we can do that. Now, having said that, some people are beyond body tight. Okay, if you have a bunch of stretch marks and you already kind of have like a little bit of a pannus and things are hanging out, or you know, then you know really the solution is most likely going to be a tummy tuck. And a lot of patients know that too. They come in knowing that they're going to need, you know, 2 procedures. I tend to stage them out because of the rules that we have here in Florida, where we can only remove 1 liter of fat when we do a tummy tuck. So it's 2 separate two separate surgeries. But you know, a lot of patients know that they're going to have to come back for that tummy tuck, and we discussed that as well.
Other than collagen, is there any creams that you can use post-op that will help your skin?
So, well, you definitely want to do the moisturizer lotions, okay? And you know which ones are okay. The Aveeno is fine. The cocoa butter is okay too. There are a lot of creams out there that say that they firm and tone the skin. Okay, if you kind of just search that up, you're gonna have a ton of them, and they go anywhere from like fairly cheap to ridiculously expensive. All right, so which ones actually work? I don't really know. You know, we don't have necessarily a skin line here at Pure. That may be something to consider in the future, but we don't have that right now. So what I would say is, you know, definitely do your research. Make sure that what you're paying for actually works, because there's a lot of creams out there that are very expensive and don't do much more than cocoa butter.
In your experience, is there a difference between different shades of skin?
Yeah, there's some differences there, but it's not so much about the shades or the Fitzpatrick type of skin, but more about, you know, really how that skin kind of feels when I do the physical exam, basically. And then of course some of the evidence, which is the most obvious one is the stretch marks. Okay, so is there much difference with, say, a Fitzpatrick type 2 skin with a lot of stretch marks and the Fitzpatrick type 5 or 6 skin with a lot of stretch marks? Not really. But you know, women that have higher estrogen levels do tend to have better quality skin. Okay, so there is a correlation there. Estrogen does improve skin quality.
So which procedure should we choose first? Tummy tuck versus liposuction?
So that's something that we tend to, a decision that we tend to make together. There's no cookie cutter patient, no cookie cutter surgery, okay? So if you say for example, you do have some issues with skin laxity, but there's some limited fat, and we want to try to use as much of that as possible, then it makes, you know, sense to do the BBL first, and then come back and do the tummy tuck later. Now, the opposite is also true. If you have a lot of like hanging skin, like a pannus that really hangs over, in those particular cases, it's better to do the tummy tuck first and then the BBL, okay? And then, you know, sometimes there's a kind of in the between where there's some patients where you can do the BBL first, and, you know, much to like my surprise and the surprise of the patient, their skin actually retracts well, and they then don't need the tummy tuck. And I've seen that too. But let me pose, you know, this question. You know, I know there's a few patients out there, and they complain about the belly button and the skin hooding of the belly button, and they're not sure, and they want to say that it's uneven lipo, but it's not. It's a skin issue, which I just discussed today. And so I want to pose this question to those patients. Have you ever seen that issue with someone who's had a tummy tuck first? And the answer is pretty much no. Maybe there's one person out there, but the answer is no, because they've had their skin tightening procedure beforehand. Okay? But think about it. So yeah, you see people with, that complain about the hoodie or the belly button. Have any of them have already had their tummy tuck? They had a tummy tuck first and then the BBL. Almost never happens because they've already had their skin tightening procedure.
So can you get body tight in the abdomen during a BBL?
You can get body tight in the abdomen during a BBL. You have to do some liposuction first because we want to use some of that fat. And then once we do the body tight, then that fat's no longer usable because it's, the heat that the body tight produces basically makes whatever fat's left there non-viable, so it doesn't work for transfer. So certainly you can use it. You can do body tight for Lipo 360 because we don't care about whether the fat lives or dies. We're just going to chuck it anyways. For the BBL, we can do it, but we have to kind of move, shift things around. The most ideal way to use a body tight is to actually, do the tumescent fluid first, and then the body tight, and then the liposuction. That's the way that it's been described, and that has the best results. When we do it, in the BBL, we kind of have to switch the order around. So you're going to do the tumescent, we got to do some liposuction, then body tight, and then probably a little bit of liposuction after that. And whatever we do after the body tight cannot be used for the transfer portion of the procedure.
Can you do a BBL and a tummy tuck together?
Right. So technically, can it be done? Technically, can be done, but we don't do it here at Pure. Why is that? Well, because we follow the rules, okay? And the rules given to us by the Florida Department of Health are that when you do a tummy tuck, you're limited to only 1 liter of fat removal via liposuction, okay? And for most patients, that's not enough for an adequate transfer. Most patients require at least twice that. They require about 1,000 cc's or more per side. I would say the average that I put in is somewhere around 1,500 maybe, 1,400, around there. That's kind of the average. And so putting only 500 cc's per side, for the most patients won't create as much of a desired change that patient wants, okay? So if I have a patient who say their BMI is 22, they've had a few kids, so they have a lot of stretch marks and skin laxity to the lower abdomen, and they say they want to do like just a small transfer. Like they don't really want to change so much, in terms of projection. Maybe they just want to fill the hip dips a little bit. Can I do it for that particular patient? Then yeah, they have to know that the max that I'll be able to remove is the 1 liter. I'll split that in half, 500 per side. That's all you're going to get, and then you do the tummy tuck.
If you're conducting a BBL, transferring fat, can you also transfer fat to the breasts? Is that a good alternative to implants?
Right, so I personally, I don't like to do fat transfer to the breast. I know of course, there are surgeons out there that do, but I don't like to do fat transfer to the breast for a few reasons, okay? Number one, you can only really create a modest change, okay? You can't create any like really, large change with fat transfer to the breast. Number two, you can't really alter the shape of the breast, okay? So when you do fat transfer to the breast, you're adding some more volume, but you're not altering the shape, okay? And then number three, the breast doesn't have great blood supply. It's not as good as the buttock, and so the chances of fat necrosis are higher in the breast than they are in the buttock, okay? And that can become an issue in the future when you then start to need to do your mammograms, your ultrasounds, and the areas of fat necrosis can be potentially confused with something else, and then you have to go through, biopsies and things like that, and perhaps some unnecessary procedures to make sure that it's just fat necrosis and that's not breast cancer. So for all those reasons, I don't like to do fat transfer to the breast unless I'm just trying to fix a very kind of small defect or something like that. I would much rather prefer the use of implants for breast augmentation.
So when it comes to skin elasticity of the breasts, how do you determine if somebody needs a breast lift versus just implants?
Great, actually that's a good question because it does have to do with this topic. I know I focused it on lipo and BBL because that's where we get most of the questions and complaints and stuff about. But skin elasticity is very important with the breast as well. That's one of the reasons why a breast lift with implant will almost never look like a straight breast augmentation for very similar reasons. So when you do a breast augmentation, that's typically a patient that comes in with a small breast, like an A cup or a B cup breast. Okay, it's a breast they've never really been stretched out. Okay, it's a breast. Usually those patients have not been pregnant. They haven't had any breastfeeding, and of course the breast didn't grow significantly. So it's a smaller breast with skin that has never been stretched out, so it's higher quality, more elastic skin. And then you're placing this relative to the breast, a relatively large implant, and you have that very nice kind of round, augmented look. Okay, all right. Now when you have a breast lift with an implant, that you're starting from a very different, starting point basically. That skin, if you're doing a breast lift, is because that skin's been stretched out for one reason or another. It's because the breast just grew, or because it's gone through pregnancy, through breastfeeding, or for whatever reason that skin is stretched. It's not this type of skin, but this type of skin. Okay. And so it does not have as good elasticity. It's not going to hold an implant like high and tight like that, because it's going to have a tendency to kind of just stretch out again. And so while I can make it fairly tight on the operating room table, and I always make it as tight as I can without getting into trouble, like nipples dying and bad stuff like that, or wounds opening, you can only take things so far before you get into trouble. But after about 3 to 4 months, you will notice that the skin will give some, and the implant will come down. And that's just the nature of what you're starting with. Okay, so I did mention this during my breast lift talk. Breast lift with implants will not look the same as a straight breast augmentation. Okay, it was one of my real deal with Alex Earle points that I made in that talk.
When you're doing a BBL, what areas of liposuction do you cover? Specifically, do you cover the upper back?
Yeah, so when we're doing the BBL, what typically comes with the BBL is a Lipo 360, okay? And so what does that mean? That means that we cover the abdomen, okay? We cover the flanks in the waist area, and then in the back, we cover from just above the brow line down. So really it's most of the back. The areas that we don't cover in the back, and it's considered an add-on, is kind of the upper back, kind of the buffalo hump area and the upper back area. Other add-ons are like the subaxillary area, so in the front here and below the axilla are considered additional areas, and then of course the arms, the chin, the thighs would all be considered additional areas.
If you get Cell Saver, will that help your skin elasticity, and can you get that with any procedure?
So Cell Saver is only effective for like the big liposuction cases and the big BBL cases, which involve liposuction. It's not helpful for mommy makeovers or tummy tucks or things like that. And it really has nothing to do with skin elasticity at all. So Cell Saver, what it does is that it basically filters out your blood from some of the fluid that we remove with the liposuction, and then we're able to give that blood back to you almost as an auto transfusion, and therefore the overall blood loss for the case is less, okay? And so you feel better, you feel stronger, your recovery is quicker, and there's less chance of needing a potentially transfusion after surgery.
So for the patients who are on the edge about their skin elasticity, how much water do you recommend that they drink, and is this before surgery and after?
Well, you can start before. You can start before, and it's definitely important after surgery. And you have to drink 1 to 2 gallons a day of water, which is a lot. Believe me, I don't drink that much. I know I don't. In order to drink that much, water, and this doesn't have to be before a procedure it can be just water. After the procedure, it shouldn't be just water. It should be a combination of water and then something like Gatorade or Powerade and pineapple juice. So because you need some of those electrolytes, you need some of those calories after surgery. But a gallon is something that you really kind of have to like actively think about and mark out to make sure that you're reaching that goal, especially if you're going to go above that goal. Okay, so you really have to kind of work on it to make sure that you're doing what you need to do to drink enough fluids after surgery.
Do you offer anything before surgery that helps with skin elasticity, as far as vitamins and?
No, not really. I mean, like I said, a lot of the things we can't change. So if you come to me and you're 35 and you've had 3 kids, and you've had sun exposure and you smoked in your 20s, there's not much I can do about any of that. Okay, that's just, it is what it is, and we just have to be informed, right? I think what affects patients the most is when they're surprised. They're like, oh wow, why did this happen? I don't understand. No one ever told me. Okay, and that's what I try to do with these lives. I try to get people to to be educated on these things so that they know what to potentially expect, and they also know what are the potential solutions to the problem. But is there anything that I can give you? There really isn't, but like I said, the hydration issue is the one thing that we can affect. Of course, smoking, if you are a smoker, you have to stop. So that's another thing that we can change. And then the rest, are kind of just the way it is. We can affect how much sun exposure you had. We can affect your age. We can affect whether you had pregnancies. We can affect whether your BMI is high or was high at one point in time. And of course, we can affect your hormonal changes. So these are things that they're just, it is what it is.
I know you have to go soon, so for the last question, J plasma versus body type. We know that helps skin tightness, but what's the difference, and is it worth it?
So there are two different machines, but they use the same type of energy, which is a radio frequency type energy. Okay, and so I like the body type because it's more versatile, meaning that it has multiple different hand pieces that I can use in different parts of the body. So it has like a little tiny one that you can use for small areas, such as like the lower eyelids. Then it has kind of the medium-sized one, which you can use for medium-sized areas, which is like the chin and the neck. That's called the face type. And then it has, of course, the larger probes for the bigger areas, such as the arms, abdomen, back, and thighs. Okay, so that's one of the things I like about it. It also has some more safety features, as it basically measures the temperature and it warns you when things are starting to get too hot. And so that's a great feature there for that machine as well. All right, and what was the second part to that question?
What's the difference between body type and
so like I said, so the type of energy is just used the same, and then is it effective? I'm sorry, that was the second part.
Yes, sir.
Yes. All right, so is it effective? Yeah, I think we've had some great results. Especially the two areas that I've seen it work the best, and of course some of the areas that we add on the most are the chin and neck area and the arms. I've seen some fantastic results with that. And is it going to be, say for the arms, is it going to be the same as an arm lift? It's not going to be the same as an arm lift, okay? But you're saving yourself that long, nasty scar, right? So say you have skin that hangs to here. With an arm lift, you're going to bring it up to say my arm here. With a body type, you may go about 50%, but you're not having that big, nasty scar that goes from elbow to armpit. So I think it's a great solution. It's a great solution for most arms. Now, of course, you have that really, really long kind of bat wing because you lost 150 pounds from your gastric bypass surgery. No, it's kind of not going to help for that. For that, then you should do your brachioplasty or arm lift.
Okay, one more question. Chin lipo or face type?
Okay, so I think that's a great question. Having seen what face type can do, and I've had some more experience with it now, I would, if it was up to me, everyone would add face type to their chin. Like I would do it like 100% of the time. I've had much better results adding the face type. Much less issues with loose kind of skin after the chin lipo when we do lipo alone, because I've seen that a couple times, and I haven't really seen that once we add the face type. And I think the contour is much nicer as well. So I know there is a price difference, of course, but if it was up to me and my recommendations, I would recommend face type for every single chin we do. All right. Okay, everybody. So I hope this kind of explains things. I know a lot of people had questions and everything else, so we went through the kind of the biology of it. We went some possible causes, possible things that we can do to prevent it, and I hope the crude demonstration there was helpful as well. Okay, so I want everyone to then tune in, all right, next week on Wednesday, because we're going to have Hump Day with Dr. Alex Earle. We'll see you guys then. Okay, everybody? Ciao.